As we've launched Rogers Connect Care, there are questions that people have asked us, and we thought we would try to answer some of the most commonly asked questions. One of them has been, how often do I see a psychiatrist, and can I get my medications while I'm participating in Rogers Connect Care? So just like you would in person, you get to see the psychiatrist once or twice a week, and perhaps more often if your symptoms have increased during this time. We have an electronic medical record that allows us to electronically prescribe your medications so that you can still continue to pick them up at your pharmacy or have them delivered if that's an option for you in your community. So you can continue to have your medications and have them changed if that's what's needed for your care.
Another question we get is about what materials you need to participate. We are offering this over a secure HIPAA-compliant platform, and it requires that you have a smartphone, tablet, or computer that has a camera with the camera enabled, and that you have a high-quality Wi-Fi connection that at least would allow you to participate via video.
It's also important to have a private space to engage in therapy, particularly during groups, because we want to protect the confidentiality of all of our patients. A really common but sometimes difficult question to answer is, how long will telehealth continue at Rogers? And really, we're doing this to ensure that our patients and our staff are safe during this time. We're working hard to follow CDC and local public health guidelines. We're also looking at each state where we operate and where our patients are at their safer at home or shelter in orders. So we will continue to provide this as long as it's really necessary in order to keep everyone safe. We are certainly talking with our patients as they are in treatment about the possibility of a return to in-person treatment as things progress during this pandemic. So it's something that we would want to talk about during your treatment with us while you're engaging in telehealth.
And we'll do everything we can to make a transition as smooth as possible if we do move from Connect Care to in-person treatment in the clinic. And we'll continue to work with your insurance provider and whoever else is needed to make that transition go as smoothly as possible.
Parents, of course, are concerned about kids and their screen time while they're at home during this unprecedented time. So we often get asked, what about my child being in front of a screen all day during Rogers Connect Care? So as a pediatrician, this is near and dear to my heart because I talk a lot about not getting excessive screen time. For this, though, we really see it as something different because they are engaging with others and receiving evidence-based treatment in order to address significant symptoms that are impairing their life. So whether it's anxiety or depression or other issues that are preventing them from functioning, engaging with others to make improvements in those areas and to feel better and to function differently, we really view as something separate from screen time that might include video games or TV, something like that. So we're really working to engage kids and teens in order to help this treatment, be effective for them and to help reduce symptoms.
Another question that we have received is about the balance between virtual treatment and virtual schooling, as we all know that a lot of virtual school is happening right now. And that is really answered typically on a patient-by-patient basis as we take into account your child's symptoms and educational needs. We do often have treatment assignments that are very related to school and maybe completely overlap in some instances with online schoolwork that might be completed. Another question that we've been asked is how to access the virtual meetings. So this is a simple process. Our team member will send you an email invitation to your personal email with a link to the group or individual session. So you simply go to your computer, make sure your microphone and camera are working, and click the link, and then you can join the meeting right away.
We are also asked about families, kids, adults building rapport with a therapist or other treatment team members virtually. Because it's a new medium for some people, it might feel a little intimidating or as if you can't build rapport with people over a screen. I think a lot of our kids are actually more familiar with it, and so it could be easier for them. There's also things that we can do as providers to help people feel more comfortable, such as engaging in some small talk more than we would necessarily in person. So there are definitely things that we're doing to try to help people feel more comfortable. And for some, it actually feels quite comfortable There's also research that for some people with certain backgrounds, perhaps such as trauma, that the virtual platform can actually feel safer for them in the beginning.
Mm-hmm. And for those who really struggle with being on camera, seeing themselves, hearing themselves, participating virtually, that can actually be a relevant treatment target that could translate into other areas of their lives, especially right now where we're doing many things virtually.